Tobacco causes almost 6% of deaths due to TB. Men around the world smoke more than women. That's a known fact, and in many countries substantially more. While we rejoice in the fact that very few women smoke, for the industry that is an entry point. They also rejoice that few women smoke so that they can actually go and target women, and they're targeting young children. This is a major health problem in the making in terms of heart disease, TB and so on, which I think we need to have very strong action to stop these from happening again. The major challenge that we face from the branch that I work in WHO is in terms of tobacco. The major challenge is to help people to give up using tobacco. Tobacco is a drug. Tobacco is a product which is promoted by an industry whose only purpose is to make money at the cost of the health of people. So our biggest challenge is, how do we get people to give up a product which has no benefits whatsoever to them, which costs them money, and which eventually will kill more than half of the people who use it and kill them prematurely. The easiest and most efficient solution is the application of what WHO calls the WHO Framework Convention on Tobacco Control. It is the only treaty that countries have signed that addresses the problem of tobacco. It has many dimensions. It tries to look at the demand for tobacco products as well as the supply of tobacco. There are countries at very low cost. The application of health warnings on cigarette packets, the work that Australia is currently doing about taking all of the glamorous showing of the packet of cigarettes itself, which is itself a marketing tool for the industry, and how can we remove all of those tools and make it reasonably easy for people. So there's a lot of things that governments can do, that societies can do, which effectively does not cost a lot of money. So it requires political will, it requires organization, the government, civil society, all working together to rid the world of this terrible product that we have, which serves no purpose whatsoever apart from making people poorer and sicker. When it comes to using drugs like nicotine replacement therapy, the World Health Organization is working with many countries to try to see how we can make those drugs as easily and as cheaply as possible. The good thing about the tobacco control is that there is a lot of effective, simple advice that can be given, and there is a lot of evidence that if people could engage with that advice, it's very effective in people giving up smoking. There is a small proportion of people who find it very, very difficult to give up, and for them this nicotine replacement therapy might be useful. But most people, I believe, can get this psychological advice at reasonably low cost. The forum has been very, very useful in helping me to reinforce the message and to use the message about how we can address tobacco and these other diseases. And I think that the Geneva Health Forum has been a very successful tool